Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and today I'm going to tell you what is the meaning of hypothyroidism. That is a HYPO thyroidism, hypothyroidism. What are the common symptoms? What is the meaning? What are the signs? And what you can do about it, as well as blood tests that are related to this. So let's go. Before knowing what is hypothyroidism, you should know what the thyroid is. The thyroid is a gland. That just means it's a little butterfly shaped organ that is present right here in front of your Adam's apple, roughly in a circle around the center of your Adam's apple. This gland is the most important gland that controls the metabolism of your body. It's like the accelerator of your body. If the thyroid works more than it should, you're going to have symptoms like an increased heart rate, sweating, nervousness, and anxiety. If the thyroid doesn't work as well as it should, you're going to have symptoms like a lowered heart rate, increase in weight, constipation, and depression. So it's like the regulator for your body. It's important to know that the thyroid is an organ that exerts all its actions, that affects all its functions by means of making two chemicals which are called T3 and T4. These are two chemicals that are made by the thyroid and then spread to the rest of your body through your blood, and it's through these chemicals that the thyroid actually exerts its effects on your body. And so whenever you do a thyroid test, it will always include the T3, the T4, and also a third hormone called TSH, which is not actually made by the thyroid but which controls the thyroid. So what you need to realize is that the thyroid is like to a regulator of your body's functions. It's like the accelerator that decides how fast your body moves, and it can have wide-ranging effects from everything like your digestion, constipation, your heart rate, your mood, as well as your fertility. And so it's very important. Now we are going to talk about what hypothyroidism is. As I told you, your thyroid gland makes two hormones, the T3 and the T4. The important hormone out of this is actually the T4, because that's the one that exerts all the functions in your body of the thyroid gland. If your thyroid does not make enough T3 and T4, that means your thyroid is not working as well as it should, it's underperforming. This state in which the thyroid does not make as many of these hormones as it should, the levels of these hormones drop, and that condition is called hypothyroidism. Hypo means less. Less thyroidism or less thyroid, that means less thyroid function, that means hypothyroidism. Now, the metabolism is the thing that suffers the most when you are hypothyroid. Your metabolism will slow down, your body will work slower than usual, and one of the most common things that we see is that the patient's heart rate itself reduces. The rate at which your heartbeat comes down. The TSH rises above 4.5, but this is a little confusing and I'll come to that later. What you need to remember is that hypo means less, hypothyroidism means that the thyroid is working less than it should, it's underperforming. The accelerator that is normally pushing your body forward has slowed down, and that is called hypothyroidism. Now I'm going to tell you how we grade hypothyroidism, but before that you need to understand where the TSH comes into all this. The TSH, or the thyroid stimulating hormone, is a chemical that is made by another gland in your brain. This is called the pituitary gland, and from this gland comes a hormone called the TSH. Now what does this TSH do? The TSH actually stimulates your thyroid to work. So here's a simple way to understand this. If your thyroid is not working as much as it should, your body realizes this. It understands that the levels of the T3 and T4 that are normally made by the thyroid have dropped, and now your body needs to figure out a way to make your thyroid work more, or at least work as much as it should. So how does the body do this? It does this by creating increased levels of TSH. And what does this TSH do? It actually goes to the thyroid through the blood, it goes to the thyroid gland, and it actually starts pushing the thyroid to work more. So one of the ways that we know that your thyroid isn't working enough is if the TSH levels have gone higher than normal, because this means that your body has detected that your thyroid is not working as much as it should, and so your body is trying to make it work more by creating more and more of this TSH. And so the TSH is the way in which we know that your thyroid is not working as much as it should, or in another case working more than it should. So it's easy to understand, if your TSH level has gone up, it means your body has made this TSH to push your thyroid to work harder, and it will only do that if your thyroid isn't working as much as it should. So the higher the TSH, the less and less effectively your thyroid is actually working. And that's why we use the TSH to kind of grade how poorly your thyroid is working. So if your TSH, which should normally be between 0.4 to around 4.5, that's the normal range of the TSH, If the TSH is between 4.5 all the way up to 10, it means that your thyroid is not working properly, but it's still in the early stages. It means it may be just a little bit less than normal, the working of the thyroid, or your hypothyroidism is just a little bit advanced, not too much. If the TSH goes between 10 to 20, it means that now there is an even bigger problem. The thyroid is really not working properly, and so your body is trying to make more and more TSH to egg it on. And it goes on increasing like that. If your TSH has risen above 20, it means that your thyroid is severely underperforming, and there's definitely a big problem, and you will need to have treatment for this. The treatment is through medications, and it's usually very successful. What are the common symptoms that we see when someone's thyroid is not working as much as it should, or the so-called hypothyroidism? The common symptoms are fatigue, unexplained weight gain, feeling constantly cold, dry skin, hair loss, constipation, these are very common, depression, low mood, slow heart rate, and swelling or puffiness of the face. These are all symptoms that we see when you have hypothyroidism or your thyroid is not working as well as it should. What is the treatment for hypothyroidism? Well, it's very simple. There is a medicine called levothyroxine, which is a supplement that is given for people whose thyroid is not working properly. This levothyroxine just mimics the effects of T4. Normally, your thyroid would be making T4, but we know now that your thyroid isn't working as much as it should, so the T4 levels are not as much as they should be, and so we supplement these levels externally by giving you something called levothyroxine. There are different medications, different names for this. All of them contain the same thing, and the usually doctor will decide your starting dose based on your symptoms and your TSH levels. I've just included a sample over here. This is not applicable to you, it's just a sample dose. And the way that we check whether the dose is enough or not is by checking your TSH. So when your thyroid was not working properly, your TSH had risen up a lot because your body was trying to make it work. If our medication is working, the body will realize that there is now enough T4, and so it will automatically reduce the TSH levels because it will think that now it has enough thyroid function, and so the TSH usually comes down. That's how we track whether our medication is working properly or not.